This week, Health and Human Services Secretary Robert F. Kennedy Jr. is back on Capitol Hill, extending his marathon 7 congressional hearings in 7 days. During contentious testimony last week, Kennedy softened his stance on vaccines, saying the measles vaccine is safe and effective for most Americans and may have saved the lives of children who died in a recent outbreak. Kennedy attempted to sidestep grilling from Democrats over his longtime public skepticism on vaccines.
We've done better at preventing measles than any country in the world.
Did President Trump approve your decision to end the CDC's pro-vaccine public messaging campaign?
We've done better at preventing
That's
measles
not answering my question,
and ending the epidemic.
That is not answering my question. And I
the
think
world.
you don't want to answer the question because I think you know
I want to respond
that
to your misinformation.
Terrible decisions that impact very, very real lives, especially the lives of children.
Joining me now is Pennsylvania Congressman Brendan Boyle. He is the ranking member of the House Budget Committee and serves on the Ways and Means Committee. And it's nice to see you again, Congressman. Thanks for joining me. So Kennedy's testimony comes amid a widespread measles outbreak in the state of Utah. As health secretary, he has imposed some sweeping changes to standard vaccination recommendations. He has promoted misinformation on public health. Were you convinced by his 180 on vaccines that we saw in that testimony? I mean, should or will it bring changes to the nation's vaccine policy?
Well, it's great to be back with you. And the sad reality is that President Trump said he was going to make America healthy again. What he has done is actually made measles great again. For the first time in my lifetime, we have seen the return of measles. This is something that had been defeated for more than a half century and now is back amongst us. And the latest outbreak in Utah, of course, as you know, is not the only one that we have seen. We've had a rise in vaccine skepticism, in part because of people like Robert F. Kennedy Jr., as well as some others. We've had that rise in vaccine skepticism ever since COVID, then combined with the specific changes that Kennedy has made while he's been secretary at HHS. So I'm glad he was at least attempting to say the right thing before us this past week. But as we saw during his confirmation hearings, he may say something in front of Congress, but then once he actually goes back to his desk, he does something quite different.
Mm-hmm. At that hearing, you talked about a constituent who lost her 6-year-old grandson, Ahmaud Butler, to a rare form of brain cancer. And last year, HHS canceled more than $180 million in National Cancer Institute grants. And then you have the National Institutes of Health facing a proposed cut of, more than $5 billion? How did Kennedy justify these cuts, and are you reassured that he is committed to funding cancer research?
Well, faced with those really disgraceful statistics, Secretary Kennedy did the only thing he felt he could, and that is he just flat out misled and lied, said that there were no cuts at all whatsoever, which was deeply unfortunate. But, this is one small part of a larger anti-healthcare agenda. Let's not forget that this president and the Republican Congress have cut more than $900 billion from healthcare in order to fund both tax cuts for the rich, as well as now an increase in bloated defense budget to help pay for all of these unnecessary wars of choice. So it shows you just how out of whack their priorities are with what the American people want and need.
Well, the White House Office of Management and Budget Director Russell Vought has also appeared before Congress 5 months after you demanded that he testify before the Budget Committee. Democrats pressed Vought to justify the Trump administration's massive cuts to social safety net programs, as well as its proposed 2027 budget, which includes, as you know, a 40% increase to defense spending. So what did you make of his testimony?
Yes, I had quite the 48 hours because as ranking member of Budget Committee, I had Russ Vought in front of me most of I think it was Wednesday. And then the very next day, we had Robert F. Kennedy Jr. For hours in front of my other committee, Ways and Means. In terms of Vought's responses, when I presented to him simply the facts, as the old TV show used to say, that more than 15 million Americans are going to lose their health care as a result of the tax bill that was passed last summer, I cited the CBO official score. I cited both right of center and left of center groups that have verified this and said it will be at least 15 million Americans who will lose health care. And then I asked him about his comment that, oh, well, this was all because of fraud.
Actually, do me a favor. Stop there because we have that soundbite. I want folks to hear it all because it's powerful. So, Josh, our director, let's play that right now.
In addition to the over $4 trillion it adds for our national debt, it eliminates health care coverage for more than 15 million Americans, according to the CBO. The Kaiser Family Foundation says it's actually more than 17 million Americans who will lose their health care. Are they really all, according to you? Really? You're going to sit here with a straight face and say they're all illegals, they're all defrauding the system? That's actually your position?
Yes. With regard to the people that have lost that.
I mean, that's laughable.
What is behind that claim that 17 million people, the 17 million losing their health care, are all living in this country illegally?
Well, that's great. I didn't know you had the clip and that you were going to play it. So this is perfect. Great minds think alike. Every group that has looked at this, again, not just left of center or nonpartisan, right of center groups, all agree it is absolute nonsense. You know, right now, under U.S. federal law, it is illegal to pay for health care benefits for any person who is here unlawfully. So the best that the other side can do is just to flat out lie. But here's the thing, they're going to get caught because beginning this December, the bulk of those health care cuts take effect, and those are the cuts to Medicaid. That's where about 10 million of the health care losses in coverage will come from, those deep Medicaid cuts. You can't convince someone that there's a fact that's contrary to his or her own lived experience. So when those people start to lose their health care coverage, they will know which one of us is telling the truth and sticking to the facts and which one of us is not.
Okay. Congressman Brendan Boyle, come see me again. Thank you so much.